I was sauntering through the Crown and Bridge department the other day, and I saw a case that had a bunch of stickers on it and question marks, and I thought, oh, this should be good. So I picked up the impression and took a look at it, and of course it's a double arch impression in a plastic double arch tray, and it's for a single unit crown, actually a PFM crown. As I roll the impression over, we can see that we have a couple of issues. We got to pull over there on that margin. Becomes a little unclear as we come around here. Looks like there's you can see the margin around here and then a little groove there. Anytime I do that, it's usually from cutting off an old crown, but maybe not, because then it would probably be a little bit more up on the prep. And if we zoom way in, you can see that shiny bit of material there. That always scares me just a little bit, to see it look so much shinier, that lump right in the middle compared to, say, all the impression material around it. You know, sometimes that's an indication of something that's not fully set. It feels fully set, but I think most of us who've been taking impressions for a long time know that we look at the dull look of a polyvinyl, especially after it's been poured, for example, and then we look at this shininess and kind of maybe how soft it is too, if you look at that when I poke it with the Explorer versus maybe if I poke this. I don't know, it just seems kind of suspicious, because why does it look so shiny and nothing else does anywhere else around there? And of course, when you look at an impression like this, it can be difficult to know exactly what's going on. And I always say that one of the ways we get to cheat here at the laboratory is by having the stone model to look at, something that the dentist never gets to see. It's a view that we get once we pour up the impression. And this is also one of my most compelling reasons for taking digital impressions, because instead of ending up with an impression like this, when we take a digital impression, what we actually see on the monitor is not the impression at all, but a virtual model. So at least we get to see, it's not a three-dimensional stone model like this, but we do get to see a virtual model and not an impression. So as we look at this, it does look like there might be something going on here that doesn't look necessarily like the way it was prepped, especially with this groove kind of coming out of here like we see there. If we look at the buccal margin, we kind of see that little area I was pointing to where I said it looks like that's where I cut off a groove, but the margin does become kind of indistinct there as we get to the mid-buccal portion. But the bigger thing is, it looks to me like we have a big undercut. And as I look over on the lingual at this undercut, you know, if you look at it from, the more you tilt it, the better it looks. And you look at it there, you go, hey, nice, that's a nice margin. And then as you bring it over this way, you can tell that the whole prep is in fact leaning to the lingual. And so it's difficult as we roll over to try to visualize that margin in the base of that wall. We never see the buccal at the same time. So the notes indicate the doctor was called and he said, do your best. And that always cracks me up when a doctor says, do your best. It's like, okay, now we're going to draw the line in the sand and we're all going to hold ourselves to, you know, the highest level of quality possible. But I understand, for all I know, this was a patient who was gagging and there was other issues that made it extremely difficult to work on this patient. So judge not lest ye be judged. I just know that probably it's going to be difficult to make a great crown. We're going to have to make a lot of relief on the inside of that crown for it to go down with that kind of undercut. And so what happened was that the dentist called and said that crown didn't fit. I'm going to take a new impression. And this is the new impression that I saw sitting in the box. And as I looked at it, it had already been poured, but it kind of struck me as odd as I looked at it, because I saw color on the inside of that besides just the purple. So it does look like the same impression materials that he used before. But before, notice how the wash material is throughout, the purple materials throughout the entire impression. And here on the new one, it's just really kind of concentrated in that one area. And so when I saw this color, I thought it was a residue from the stone, and then I started poking and there was something hard in there. And that's when I actually looked and read the rest of the RX. And there's a note from the doctor saying that the crown needs to be remade because it didn't fit, the margins wouldn't close. And it said that the crown was inside of here. And I thought, oh, that's interesting. And this is actually being pried out for the first time, as you can see, as I snap a Bard Parker, using it for the wrong purpose. If I had a cord packer here, I'd probably use it. Really, all I'm trying to do is get this crown out. It's already been poured, so I guess at this point I can go in and just kind of jam around. And let's take a look at that crown. Well, he certainly adjusted the internal portion of it to try to get it to fit, even though it didn't quite fit. And for some reason, he used the crown kind of as I guess, a copper band technique. I never used copper bands in dental school when I was there from, until 1988. We never actually used them. But it looks like he relined the crown. In fact, it says that he did on the RX with the impression material, resat it on the prep, and then took a pickup impression over that. And that was the fascinating part of it to me, is why you would do that versus just taking a new impression. To squirt the impression material in here and push that down on the tooth, I guess you would think that, well, there's no way that I can miss this impression with that kind of adaptation. So with that crown buried in there when it came in, the model and die people poured it up, and there's this chunk out of the lingual, and you look at it and you go, wow, well, that should have been prepped to get rid of the undercut, but at this point there's a weird chunk over there on the lingual, and if you look at the impression, you can see where that chunk is right there, and it actually is on the tooth itself, and now it's represented here. And it makes me wonder what the doctor was thinking when he took the crown and put the impression material inside, sat it down onto the tooth, and then took an impression. Now his notes that came back did say that the crown didn't fit, but the bite was good and the shade was good. So I guess he was thinking with the fact that the bite was good, you could put this into place and have maybe the patient bite down on it. I'm not exactly sure how it went down. I don't know if that sat first and then the overall impression was taken, but I couldn't really come up with a good reason why you would want the crown holding the light body material on the prep. And it doesn't necessarily look like it worked unless that's what the actual prep looks like, but that's kind of hard to believe that's what the prep looks like, because I don't even know how you would do that. It's smooth. I don't see any burr marks. It's kind of wedge shaped. It doesn't even look necessarily like a football burr, so I'm not exactly sure. We're going to have to wait to see if that crown fits when we hear back from the dentist again. What I find to be interesting is to see whether or not the crown that he sent back actually fits the old model that we sent out, because he said it definitely didn't fit the patient's tooth. All we can do at the lab, and I'm not trying to absolve us of responsibility, but really, as you know, all we can do at the lab is make sure that the crown fits the model before it leaves. It comes down to the impression whether or not what fits the model will fit the patient's mouth. But I really don't know how this is going to fit on here. And it kind of fits. It kind of fits. I would expect it to be a little bit loose. A little bit of play. Remember that big undercut on the lingual? I said we're going to have to leave some room for that. And yeah, it's loose, but it kind of fits, and it seems like it goes down. Enough so where if it fit like this, I'm 99.9% sure if it fit, of course there's no retention, but if it fit like that in the patient's mouth, that this crown would have been cemented. So I think it stands to reason that there was in fact something wrong with the first impression, because it looks like it fit the model well enough to have the doctor cement it, although he didn't cement it because it didn't fit the tooth, and therefore that caused him to take the second impression, which had the crown as the copper band, if you will, holding the light body material, and then a pickup with blue mousse around it. And I'd love to hear from anybody if that's a technique they've used or found to be effective, but it seems weird to use this as the quote-unquote impression tray for the light body material, especially when it didn't fit. And you can tell how much it didn't fit, because if you look, when I still had the crown in here before I busted off the barred Parker and everything, you could kind of see some color change, but it's not like you could see spots of the crown showing through. So it looks like, they left a ton of relief to get rid of that, to accommodate that undercut on the prep. and as a result, there's a pretty thick layer of impression material on the inside of that. But I'm not sure why that was being used as an impression carrier on top of the tooth, and why a new impression just wasn't taken. So if you know, or if you've used this technique, please write in and let me know, because I would like to be educated about that and hear why that might be a good technique. And at this point, all we can do is wait to hear back from the doctor and see if the the new crown that we make on this model fits. I'd be surprised if he wants us to make it, but you'd be surprised sometimes what Dennis asks for. So we might in fact just make the crown on here if he doesn't want to take another impression, and tells us to do our best and send it out, and we'll see what happens on attempt number 2.